Well, we can hopefully in a moment talk to Denise, a few technical issues, but we've also got Professor Keyoumars Ashkan, who carried out the surgery, on the line to talk to too. So Professor Ashkan, explain what this operation was that you carried out on Denise. What was the point of it? What were you hoping you would achieve?
Thank you. Good afternoon to you and to your audience. The operation we did is called deep brain stimulation. So it's an operation whereby we insert electrodes deep inside the brain at very particular target points inside the brain in order to change and correct the abnormal functioning of the brain. So for example, in Parkinson disease, which is a condition that Denise was suffering from, one of the main problems of this are the motor aspects of the movement. So patient has got difficulty with speed of movement, patients have got difficulty with stiff muscles, difficulty with tremor, and all those obviously affect their daily functioning. So as you mentioned, Denise had difficulty even walking, doing many daily activities that we take for granted, swimming, many of hobbies that she could no longer enjoy. And one of those hobbies very central to her quality of life was being able to play the clarinet, because she used to play in her local orchestra, local band in East Grinstead. And unfortunately, for the last 5 years, because of the Parkinson disease, she's not been able to play this anymore. So,
well, I'm delighted to say, Professor, that Denise does join us now. We've managed to sort out those gremlins. Denise, lovely to speak to you. We're just hearing from the Professor about how much you love playing the clarinet, how it was a big part of your life. How did you feel when he suggested this surgery that would involve you also playing the clarinet?
At first, I was quite sceptical that it would be possible to play the clarinet laying on an operating table. But I contacted him nearer the time and said, "Do you really want me to bring my clarinet?" And the message was that yes, he did, and he'd be able to test whether it would help me.
Did you have to do anything to the clarinet? Did you have to sterilise it, for example?
No, it wasn't that side of the partition. I think they were sterile behind me.
We heard a little bit from the Professor about the impact that Parkinson's has had on your life. Just talk us through what difference it's made to you.
Sorry, Parkinson's?
Yes.
Yes. Well, by the time I was just about to have the operation, it was quite difficult to move, and I would often freeze. So, for example, just walking around the kitchen trying to cook a meal was difficult, because the minute I tried to turn from one worktop to another, I was just stuck to the floor. I could walk, but only slowly, and it was like walking through treacle. And so that was, by 11, it had taken 11 years to get that bad.
And Professor Ashkan, you obviously believed that this operation could improve those elements of mobility that were affecting Denise. Is it common that you ask patients to bring along a prop, something like a clarinet?
So it all depends on patients' quality of life and what matters to them. So before every surgery, I go through a goal-setting exercise with my patients, because I want to understand what are those factors that's going to be bring back the quality of life that I lost because of the Parkinson disease or any other conditions that they may have. So if part of those goal setting is ability to play the clarinet or do any specific tasks, then I try to optimize my surgery in order to achieve that goal for them. So this is what we call personalized medicine. So for every patient, there is a goal. Everybody is different. Everybody has different aspects to what they consider as key to the quality of life. And if those are impaired, then I try to adjust my surgery or modify it in a way that I can achieve those goals and give the patient what matters to them most.
So we're looking at these images of Denise lying there, playing the clarinet. While she's playing, what are you doing behind that screen?
So quite a lot. So I would have made a cut in the skin. I would have drilled a small hole in the bone. I would have inserted the electrodes, which are the fine wires, all the way to the brain. These are literally 1.2 millimeter in diameter, so really thin. And then once we got the electrode down to the point of interest, the target, then we would send test electricity. As you can see, my neurology colleagues examine the patients, look for improvement in the stiffness, slowness, They look for various the tremors, if that patient got a tremor, and they will feed back to me so I can adjust the electrode position real time based on the feedback that I'm getting from the body side whilst I'm operating on the head side of the surgical theater, and essentially optimize the position of my electrodes so I know I'm achieving those improvements. Of course, in Denise's case, it wasn't just looking for stiffness and slowness, it was also there to see whether she can move her fingers good enough to be able to play the clarinet again. The beauty of this surgery is that
it sounds like science fiction, Professor.
It's science fact.
Yeah, science fact. Denise, it must have been nerve-wracking surgery. Were you worried about it? You look very relaxed there, playing your clarinet and moving your fingers about.
It did look relaxed. I think anyone would be a bit apprehensive, but I've been made aware of the risks quite some time before, but decided that the possible benefits really outweighed the risks, and I really wanted to have the operation.
And now you've had it, it's been a few months. What has the outcome been like for you?
Well, I can walk normally. I was walking normally straight after the surgery. And life's just opened up again. It feels like there's a future.
Wow.
Yeah.
That's absolutely lovely. Professor Ashkan, how long will these positive effects hopefully last for Denise?
Well, obviously, Parkinson's disease, unfortunately, is a progressive condition. So over time, patients gradually get worse. But we've given Denise a boost now, and that boost will remain. So at any one time, she would have been better off with surgery than she would otherwise be. So the system is there 24/7, working 24/7. In fact, the system that she has is called adaptive DBS. So it's a clever version of the system whereby automatically will assess patients' need and can adjust how much stimulation the device provides, what we call closed loop system. So hopefully she has a personalized treatment that's going to last her many, 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 many decades to come.
Fingers crossed. And Denise, what about the East Grinstead concert band? Are you going to be back making an appearance?
I hope so. I've been playing the clarinet sort of a few times a week, and every time I play it, it gets easier. So, yeah, that's my aim.
Fantastic. Well, it's just amazing to speak to you, Denise, and really great to talk to you as well, Professor Keyoumars Ashkan. Great story and lovely to have a good news health story to bring to our viewers on Sky News. Thank you both very much indeed.
Thank you.
Thank you.